I'm ready.
Okay, let's do this. Hey, everybody, and welcome to Morgellons discussion and microscopy videos. I'm your host, Jeremy Murphy, and today, well, we're running a little bit late, guys, but we finally showed up here, and I appreciate everybody showing up as well. No, the Dr. Morales is just fine. He's going to be here in a second. I'm going through the comments on the chat. These are interesting. But so today, it's the very first day of Morgellons Disease Awareness Month, February 2024. Dr. Omar Morales from the Lyme, Mexico Clinic has agreed to join us for a live interview. Dr. Morales, how are you doing today?
Hello, Jeremy, and hello to all your audience. It's a pleasure being here with you guys. I'm very passionate about this topic. I'm very passionate about what I do. And I'm just happy to be here. I hope that we get a lot of questions, and most importantly, that we get some answers. And that's what we're here for, to help get some answers on Morgellons.
Definitely. So tell us about your practice down there. What is the Lyme Mexico Clinic, and what's it all about?
So my practice is focused on tick-borne disease, and I see patients that have issues related to infections in their blood and consequences of those infections. We have other conditions that we're also focused on. And so we've been doing this for a little bit over a decade, and we try to do the best to contribute to eradication of these different illnesses related to tick-borne disease.
Wow. What got you into Lyme disease specifically?
Well, it all happened about 10 years ago when I was involved in the blood bank. I still am involved in the blood bank. I run the blood bank here in the city. And there was this patient who contacted us from Utah, and he had a infection that was infesting all of his red blood cells, different infection in his red blood cells that he was able to see in the microscope. His physician was seeing in the microscope. So that infection, they send us some images of it, and we together we devised the treatment to replace that patient's infected blood for healthy blood to help him, because he was actually having organ failure. His bloods were collapsed. His blood cells were collapsing, and his kidneys were shutting down. So it was a last kind of resort situation. They flew in and brought their own physician, and the physician, he was an ILADS member of all places, and he was gracious enough to teach me about Lyme disease. And through that process, we became very close, and he became somewhat of a mentor to me, and still is. And I got to do a very unconventional treatment for what I'm told right now. We are the only people in the world doing it this way. Even though there are many articles that relate to red blood cell exchange for the treatment of Babesia and persistent babesiosis, we are doing it on a daily basis, basically, because we see so many patients from all over the world. A lot of Babesia from Australia, Babesia from Poland, Babesia from the United States, from Canada. Usually, there is a special section of treatments that are supposed to happen for Babesia based on the CDC guidelines. For instance, there will be different grades, grade 1, 2, and 3, depending on the evidence on these treatments. And so Babesia treated with red cell exchange has actually a high rate evidence of treatment. So I believe it's 1A or 1B, and it's for patients who have a heavy load of parasites that have not responded to the conventional treatment. So it could be used as a second line of therapy. And patients that usually use it in other countries are only selected few. They just try not to do it as much. They mostly use it for patients, like, for instance, with HIV and Babesia, or patients that have been splenectomized without a spleen and Babesia. And so those would be the prime candidates. I'm not saying that red cell exchange is what we should do for everybody. That's not how it works. But it is a life-saving option for patients who are dealing with a very heavy load of bacteria and parasites.
What is Babesia? Is it like a parasite, like a worm, or is it like a spirochete, like Lyme disease? You compared it to HIV. Is it like a virus?
It is a intracellular parasite that has different stages. It is comparable to malaria that has a trophozoite and a merozoite stage, so that it goes in hibernation and then has a active form as well.
Mm.
And as a parasite, it sticks to the blood cell, and it allows the blood cell to live for more than 120 days, which is the allowed normal amount of time for red cells to live,
Whoa.
so that it doesn't have to go and look for another host. And as a result, we get anemia, macrocytic anemia, because the red cells are enlarged and they're old and they don't carry enough oxygen. And Babesia can also live and coexist with other infections that we see in ticks. Let's not forget the ticks, they bite different animals, reptiles, snakes, birds, cows, mice, rats, dogs, and then they end up biting us humans. And
Really?
so each time they're biting, they use their mouth to engulf blood from the blood vessel. They attach under mouth a special harpoon to engulf the blood, and as that tick is engulfing, it's getting in touch with the organisms that are in his gut, and
Oh,
so it is between that connection that the pathogens go through the blood into the patient, who is now getting sick with the infections that with that tick has, which involves parasites, viruses, and bacteria all together. So it can coexist within a tick, and then it will also coexist inside the host within biofilms too, which we can talk about that. But and I get asked this often: what happens to patients who get infected that do not get infected by ticks? Like, for instance, with patients who get infected through placenta, like
yeah.
in utero Lyme disease, or sometimes in utero Babesia, or sexually transmission of Lyme, which has occurred. Then the answer is there is a major difference, because when the tick is biting a host, that tick produces a salivary protein that is immune suppressive all the way down to the bone marrow of the host. So it suppresses monocytes, dendritic cells, T cells, CD cells, and a cascade of immunological reactions. And that is the reason why the infection is so potent. And that's why 40% of patients become chronic, because the immune system is suppressed,
Mm.
because the tick saliva made it suppressed. And it also produces another substance in its mouth that injects a blood thinner, so that it's easily disseminated to the tissues, these infections.
Oh,
The tick doesn't do it purposely. It uses that anticoagulant because it needs to keep the blood flow in from the blood vessel into his mouth and into his gut. So as a result, we get dissemination to tissues very quickly, like the central nervous system, in less than 48 hours.
wow, man, that's a lot to digest. So, besides Babesia and Lyme disease, there could be any number of pathogens that you could get from a tick. And you're saying that we could get exposure to like lizard and horse blood and all that?
We can get exposed to the pathogens that are in other animals and other species that the
Wow,
tick has decided to bite. So
man.
that goes for Powassan virus, uh, tularemia, Coxiella burnetii, Anaplasma ehrlichia rickettsia, Borrelia, Bartonella, Babesia, and
Oh,
others.
and you said it was a ILADS doctor that introduced you to the. What is ILADS? Can you tell us about that and your role with them?
Yes, so ILADS is a nonprofit organization that stands up for doctors and patients worldwide. It is an organization that encompasses all of the areas in health, from the doctor to the nurse to the physician's assistant to the naturopath to the holistic doctors to the uh, family members of Lyme ill patients, to veterinarians, to everybody that is involved with this condition. And really, this condition, Lyme, is just the tip of the iceberg. We really use Lyme as a catch-all phrase for everything related to tick-borne diseases. And ILADS, even though it's the International Lyme and Associated Diseases Society, we don't really use that term anymore. We know ILADS as the organism that puts together science and uses its researchers and its doctors to push forward in the government and the capital and the medical guidelines and the medical associations like the IDSA, like the Rheumatology Society of America, and pushes with backing up with solid science that the condition that we're talking about is much more complex than it is thought. I think it is really kind of the perfect bioweapon, to be honest, and we should treat it with a lot of respect. So we have to treat it like almost like a separate specialty in medicine that we're not really doing. And if I recall well, one of the quotes from Max Planck that I like is something about that in order to change the course on a condition, one generation has to overgrow or be exchanged for the next generation for that process to occur. And that's terrifying because that means that we won't find the cure for Lyme disease in our generation. And that, I think, is unacceptable. So that's why ILADS exists, to be able to go against that problem and be able to reduce the time and figure this out in this generation.
So really, the problem with Lyme disease and one of the reasons why it's so prevalent is because there's not really a system in place for doctors to follow the guidelines to treat this 21st century affliction. Is that right?
Yes, and we don't learn about it in medical school. The books that we currently have do not talk about it. I learned it because of an ILADS doctor. Now I'm a member of ILADS. I am actually very closely involved with ILADS, and I'm a recent board of directors member, I should say, and I'm a current chair of the Latin American Committee for ILADS. I'm also a chair of the Public Relations Committee for ILADS, and I'm right now also in the organization committee for the European Scientific Conference that is taking place in April 19th in Munich, Germany, where I will actually be presenting a horizontal review of 689 neurological Lyme cases that I was able to check the treatments that were done and figure out the best treatments for those cases and the outcome of those cases. And I'm presenting that work in that lecture.
Wow, commendable. So you've got a whole career with ILADS.
Yeah, they keep me busy.
Hopefully what y'all are going to do is going to be able to translate into just the average patient going in to see their general practitioner and having a different experience in case they have Lyme. And that's the future goal, right?
Yeah. So when I started this, I honestly was in the blood bank. That's where I started, and it was a small cubicle. And I would see a patient, and suddenly I was seeing a family, and then 2 families, 3 families, and I would have the whole waiting room of the hospital full with my patients. So I had to eventually look for my own space, and it was also a necessity to look for my own space because patients were being mistreated in the hospital. There came a moment where the director of the hospital at that time, he called me and he wanted to speak with me, and so he sat me down and he said, "I'm sorry, Dr. Morales, we can no longer see your patients because our physicians are saying that you don't have enough resources to support your diagnosis." And it was really hurtful to me, but it was much more hurtful to the patients. And the same goes for some people that don't understand the condition, but they're quick to judge and to say, you're a quack for treating Lyme. You're a quack for even talking about Morgellons, which we get all that backlash, and it hurts, but it hurts more this process that we're trying to do in this generation. But no matter, we're continuous on our on our progress against this. I've seen a lot of progress with Lyme disease in the last couple years, a lot of changes. Like, for instance, the Center for Disease Control, CDC, is now accepting that Lyme is chronic, which is a huge win for all of us. It's now accepting that it's no longer 30,000 new cases per year. It's almost 500,000 new cases per year just in the United States alone. So that speaks volumes. We're doing the things. We're doing things right, you guys. We are in the right train here, and people more and more are jumping into this train. 10 years ago, they thought that we were nuts, and I see that going on with Morgellons right now. People think that we're nuts. Like, I try to present my work, even to this day, in certain conferences, and I get denied. They tell me, "Oh, Dr. Morales, but you speak so nice about other conditions. Why don't you talk about these other things?" And I, like, no, because this is also important. And so sometimes we have to sell this product a little, this whole Morgellons idea, because a lot of people don't want to talk about it, and they want to shut us down, and we need to fight it.
That's interesting. So is it seen in Mexico that Lyme disease is prevalent, or is it like in some states in the United States, like in the deep South, where they don't really consider Lyme disease to be prevalent in the area? In Australia, they don't regard as having Lyme disease there at all. Is Mexico similar to that, or how's the feeling of Lyme
Well,
disease here?
it's very simple. Ticks have no borders. They are endemic to the United States. They are carried in animals, in birds, and in humans. We have a study in Mexico that actually shows more Lyme in areas that are more dense with tourism. So people spread Lyme disease.
Oh.
And there's Lyme in Poland. There's Lyme in Spain, in Paris. A lot of Lyme in Spain. There's a lot of Lyme in Australia. We get patients from all over the place. We get patients from Italy, from Canada, obviously, a lot, and the United States being the number one.
Wow.
The statistic of 2011, we haven't updated that, shows that 1.1% of the population in Mexico has Lyme disease.
No kidding.
We also have other conditions like rickettsia. It's very prevalent. Rickettsia rickettsii, number one. Rickettsia typhi, number two. Lyme disease, somewhere around those numbers. And we talk about the connective tissue disorder that comes from Barella, Lyme, and we talk about the neurological disorders and other disorders like the heart, Lyme carditis. And so there is more than just the conventional physical symptoms, and we're seeing other issues that are now being connected to Lyme, like MS symptoms, multiple sclerosis symptoms, ALS symptoms, Parkinson's symptoms, dementia symptoms, all being connected to Lyme as a chronic condition that predisposes this to happen sooner.
So I guess that's kind of like one of the problems you face is if you have a patient that comes in and they may have Lyme disease, but they could also have like a heart blockage or something. And, how do you weigh out which one is, what do you do in that case if somebody comes in?
Yeah. So I think I spoke with you about this already, that we see a patient for what it is, all the things standing as a problem. Some patients have other issues besides Lyme, like autoimmune encephalitis or sinus issues that are infecting the bones and infecting the nerves that are affecting the basal ganglia, which are all connected. Some cases we deal with more conventional problems like heart blockages. Not so long ago, about a month, I had to, as I was seeing a patient for Lyme who came from somewhere from the United States, he kept complaining about shortness of breath and sweats. And one can easily think, well, that's Babesia. But he was obese. He just, the clinical picture wasn't just typical. So I sent him to the cardiologist, and I with a note like, look past the normal, because there's something that could be going on. And he found one of the branches of the heart 95% obstructed, and he needed to get immediate surgery, or that person may have died even before we started treatment. So we got him into the surgical table, I believe 2 days after that, and through a catheter and opened up with a balloon that artery and removed the plaque. And the patient was just immediately after the procedure feeling 20% better. And so then we started our treatment safely. And so I get to treat other things that are involved. Like, for instance, in Bartonella, I see a lot of problems in the gallbladder. And we sometimes have to take out that gallbladder. And the gallbladder, we culture it, and it's filled with Bartonella. And for, like, instance, Bartonella also creates a lot of menstruation issues because it just loves the blood vessels. Wherever it's rich with blood, you'll see Bartonella. And the bladder too, problems with the bladder, they also come from Bartonella. Problems with neuropathy, especially in the tips of the fingers where there's little circulation. We have seen biofilm of Borrelia and Bartonella and Babesia all coexisting, which is interesting because usually pathogens, they're trying to be who's on top. And in this case, these pathogens, which are chronic, they coexist with each other, which is crazy. And that's one of the main mechanisms of persistence of this is the biofilms. Biofilms are structures that are made out of mucopolysaccharides, which are complex sugars, minerals that are in the environment of the human body, salts as well, and fibrinogen, which we use for clotting of our blood, and also metals that are in the environment. So the bacteria uses that and creates an environment where it's protected, like sort of a cocoon. And as we're treating the infection resides there, and it even opens up water channels to allow the nutrients to flow into the biofilm from the environment. And if you're giving a patient antibiotics, remember that Lyme bacteria is pleomorphic. So it's a shapeshifter. It can be a spiral. It could be a straight form. It could be a bleb, which is a little bit like a snake with a head. It could be a cyst, where it's like a yarn ball, and it can be a round body, which is a persisting cell. And then the more advanced forms find their way to create biofilm. Inside that biofilm, when the infection is receiving that antibiotic and it's not liking it, it hides in the biofilm. Some of those nutrients that are coming in with water from the environment have reduced doses of the antibiotics. So the infection quickly becomes resistant to that. And that's how resistance occurs of the antibiotic from that biofilm process. And inside of the biofilm, pathogens exchange genes and mutate. This is called horizontal genetic transfer. And that is the mechanism how a dumb bacteria becomes a super bacteria by being next to another smart bacteria, creating two super smart bacteria. And that is the persistence. Once you take a step back from as a doctor perspective and you stop treating it, the infection comes out of the biofilm and reinfects everything.
Yeah. So, well, you just went over a lot of things. So it's not just all Lyme disease, and I think that's what a lot of people kind of get in their mind is that, people are just fixated on Lyme disease. They may or may not really have it, and they're just going to go see a doctor who's going to tell them they have it because that's what they want. But that's not really what you do at all. You're really looking at the patient's total health picture and making sure there's no other underlying medical conditions that could kill them.
Yeah, I always say to my patients, I'm not married to any diagnosis. My clinic, for whatever reason, because I was hugely invested in Lyme for personal and other reasons back then, the name is Lyme Mexico. Simple, Lyme and Mexico. And I made it into one name using both. So Lyme Mexico. But really, I see so many other things that have nothing to do with Lyme or little to do with Lyme. And sometimes, honestly, it's a lot of detective work, because I have seen patients that have been to many Lyme doctors, and I see their treatments. And I'm actually saying, these treatments are good treatments. You've done good treatment. Why are you still sick? I don't know. Well, let's find out. And so I have to look into these other situations, like not only Lyme and not only Babesia and Bartonella and the co-infections, sometimes even the atypical co-infections like Powassan, West Nile virus, tularemia. But I also have to look into other aspects. Is your environment healthy? Are you getting exposure to mold? Are you getting exposure to pesticides, glyphosates, any environmental toxics? Do you have root canals? Are your root canals causing cavitations? Do your cavitations are infection? So this is an important topic. This is something that I see when I see a patient. This is like a little yellow light for me of a patient that has done good treatment. The patient doesn't get better, and he has some history of dental conditions. I look into their history in the root canals. Is the root canal encapsulating infection? Are you there?
Yeah, I'm right here.
Okay.
Yeah, I'm right here. I was checking. I was checking the live stream. People were asking some questions, but yeah, please continue about the dental.
So that encapsulation of infection, you can treat the whole body. You can give the patient systemic treatment, and the infection encapsulated will not let you move forward with that patient. That patient will be in a wheelchair, and you can't get him to get out of the wheelchair because there's encapsulation from that root canal.
Oh, wow.
So you have to pull that root canal out. You have to treat that infection physically, throwing some ozone or other antibiotics or whatever that is needed. But sometimes it even goes further than that, and that's where the cavitation comes into play. If the infection encapsulated reaches the bone in the jaw, and also the maxillary bone here, the bones in the face, they get contaminated with infection. And that creates something known as Nico lesions, which are lesions that are from infection of basically necrotic tissue in the bone, causing an osteomyelitis, causing inflammation that goes to the nerves, to the scalp, burning in the scalp and the back, all down to the spine, burning in the spine. And those patients, if we don't remove the infection that is localized in the region and we don't fix this, they don't get better. So we have to look at the environment. It's not only focused on Lyme disease because that is the catch-all phrase for everything, but we sometimes have to take a step back, and if it doesn't make sense, let's not pursue it. Let's think of other options. Let's not be so stubborn on the whole Lyme disease situation.
Yeah, just looking at the questions coming in. Bartonella, is Bartonella recognized as a tick-borne infection now?
Yeah, so Bartonella is a gram-negative rod-shaped bacteria that is often found in the red blood cells, but it is also it's intracellular, but it's also found in the extracellular space. And Bartonella creates an environment that changes the mental biochemistry. It inflicts changes to the neuroreceptors so that the neurotransmitters cannot act on those neuroreceptors. As a result, patients don't sleep, patients are with anxiety, patients are with atypical mental issues that usually would not find in bacteria or infections. So it is a bacteria, and it is found in cats. You can get transmitted from cats, and you can also get it transmitted through ticks that have bitten animals that are infected with Bartonella. And another thing that I see with Bartonella is that it can cause optic neuritis. So there is a kind of a prevalence of Bartonella looking for spaces where it can feed from that region. And because the nerves are so rich in proteins, I believe that's why it can happen in certain nerves. Also, Bartonella likes to be in the smaller blood vessels, so there's a lot of circulation issues related to Bartonella.
Yeah.
Yeah.
Wow. So you're really not focused on Lyme. It's the total approach. But do you recommend people out for like an oral surgeon when they need to have some extensive dental work done, or?
Yeah, well, I know of two people. I don't know if I can mention them here. There's Amy Kajabi in California, and there's Dr. Kurtola in New York. They know well. There's some videos about them. They know well what I'm talking about because we have a lot of patients in common. I wish I could know more because this is how we're going to help out more patients by spreading the word.
Yeah.
So there are a few doctors looking at this properly, is what I'm trying to say.
Yeah, it's definitely hard to find the right person for what you're going through oftentimes. But it sounds like if people go to you, they have a good bet that you're going to look at the total picture and really get the best care.
I'm gonna make my best effort to get them better at any cost. So if they're not getting better, it's something that I've overseen. So that I have overseen, and that I have to come back and take a step back and look at it from a different angle. Have to.
Yeah.
It is, as I said, a detective work sometimes.
That's commendable to be able to look back and see if there's anything that you missed. A lot of people just keep going forward with the same thought process, and a lot of patients get left behind that way. Dr. Morales, can you tell us what is Morgellons? I think it's time to, what is Morgellons? And also tell us what you hear a lot of that Morgellons is not backed up by the science. What is your view on Morgellons?
Okay, well, this is, I think, the topic of interest, and it's also the topic of controversy. And when we started to put out there that we were talking about this subject, I got a lot of positive feedback, but we also got a lot of backlash. And so there are many people that have their opinion, and some of these people have a negative opinion on this, and we don't judge, but some people do hurt this process of trying to understand it, and by confusing the patients and the medical community, because some patients are trying to understand what it is. So you go to these forums, right? And you'll see people that are saying things that just are more confusing. I'm not saying that we know it all. I personally don't know it all. I can just say what I do know, which is the fact that in all of the patients that I've seen, there is a common denominator. The common denominator is Lyme disease. Every patient that I've seen from Morgellons, they have Lyme disease. Does that mean the Lyme causes Morgellons? I don't dare say that, because I can say it to a certain degree, but I also see other cases where I'm seeing that the infection starts by mite exposure, for instance, or Bartonella exposure, or parasite exposure, or mold exposure. And so how do you explain that versus the theory that Lyme is creating Morgellons? So either these infections are causing the Lyme to pop up in a second version, now with Morgellons lesions, which is in essence an atypical dermopathy. The skin starts having filaments and crystals and biofilm excreted through all of the pores, or some of the pores. It also gets excreted through the nose and the scalp. There's a lot of this being produced in the eyes. When it happens in the eyes have abrasions to the cornea. Happens in the nose, they look like parasites when you pull them out. Happens in the mouth. It happens in the urinary tract, vaginal tract, and the rectum, and you shed them everywhere. And so I always put all of them to a microscope, and I don't judge. If a patient tells me, yeah, I have bugs coming out of my skin and they're taking flight and they look like sandflies or this or this other, there are many parasites that they look like, I say, sure, let's put them in a petri dish, let's cut them, and let's see what's in there. And in all of these research studies that we've seen, and all of these microscopies that we've seen of these pathogens that are Morgellons, we always see three things. Number one, we see macrophages. So there are inflammatory cells in there. Number two, we see keratin, like we have in the nails. So hyperkeratosis is involved. And hyperkeratosis is affected by specific genes, which we're studying at the moment. And then 3, there is always Borrelia. Not Bartonella, not Babesia, not chikungunya. We see Borrelia. So that is the common denominator. Is it triggered by other things? Yes. Can there be a third process where there is a genetic predisposition? Yes, we're looking into genetic mutations such as IL-36RN, CARD14, and NLRP1 genes, which harvest a coding for keratin and and we know that they're known for hyperkeratosis.
Oh, that's commendable. So really, it's not about standing on any kind of a principle or trying to be right. It's about the patient and trying to help them through this healing journey, because it is an experience going through Morgellons.
I honestly could not care what the diagnosis is. If the patient wants the diagnosis, sure, I will work on getting that diagnosis. I care on the patient getting better. And if you tell me that it comes from a robot and they're micro robots and nano robots working in there, and or it's alien technology, or it is a bioweapon, which I don't doubt, who knows?
Yeah.
Sure, all of the above. And let's try to resolve it. And the way that I resolve it is with using antimicrobials. And the patients I treat, they get better. The majority of them, they get better. And so whether I'm doing things, right or wrong, my goal is always one-on-one. I'm in the trenches where I'm treating patients one-on-one. I'm not doing research for the masses. I'm doing work for the one-on-one, and so that is where I hold my what do you say? Hold your own.
Yeah, you're definitely focusing your attention on the patient. It's not about the diagnosis. It's about the health.
Yeah, and some patients, they don't, they talk to doctors, they get discouraged, they don't want to talk to us, and I understand that. I don't charge the first consult. I've never had in 10
Oh, wow.
years. It's all of the first consults are complimentary, and this helps both me because I'm learning through you guys. I learn through the patients as well.
Yeah.
I didn't read these things in a book. How do you think I'm getting this information? I'm getting in through you guys as well. And
Yeah.
so the more I talk to you guys, the more knowledgeable I become. So give me that. I want it. I want to hear you. I want to see what's going on. And for you, it's also fair, because you get to talk to a doctor and see if that's the doctor that you're looking for, or if that's a doctor that is out of his mind, or
Yeah.
does to your beliefs.
Oftentimes, that's one of the more complicated tasks a Morgellons patient can go through, is trying to find a good doctor. And you're offering a free consult. They can just call and talk to you and get an idea if this is something they want to pursue in regards to treatment.
Yeah, definitely. They should talk to us handy.
Commendable. Now, you said antimicrobials. Those aren't always antibiotics, are they?
No, so when we talk about Morgellons particularly, I have seen a breakthrough with 2 treatments, or it's 2 treatments, one of which is a combination of treatments. The first treatment is really cleaning the blood. And when I say cleaning the blood, I don't mean the red cells. So Babesia, for instance, is solely on the red blood cell. The red cell has no DNA. It has iron, it has oxygen, and the function is to carry oxygen to the tissues. And the parasite sticks to that red cell. For Babesia, yes, the best treatment would be, if it's not responding to clindamycin, artesunate, tafenoquine, etc., then that patient should do red cell exchange, because then you reduce the pathogen load to a number where then is minimal, and then you treat it with the tafenoquine or coartem or whatever, and you get rid of the pathogen, and that patient gets cured of Babesia. That's a good treatment. But when it comes to Morgellons, that is not in the red cell as Babesia parasites are. Morgellons is, and as Lyme disease, shedding all over the place, and the body tries to eliminate those toxins, and it does it through the lymphatic system and through the plasma. So in the plasma, and as I said, when I say cleaning the blood, we have to break down the blood in three. There is the white blood cells, which account for like 2% of the whole blood. And then we have the red blood cells, and then we have the plasma, which accounts for like 60% of the blood, of the whole blood.
Huh.
So that plasma is basically water with proteins and gunk that the body is trying to eliminate. There's even a study from Dr. Navio where he mentions that patients that have been exposed to antibiotics, they sometimes carry the salt, the pharmaceutical that carries the antibiotic, not the antibiotic anymore, but the pharmaceutical that carries it into the cell.
Oh.
They have it in their blood 10 years after using that antibiotic. And so we can talk about exposure to the use of, GMOs and glyphosate and food that is infested with hormones, and all of those extra added things that we don't need, they're floating in the plasma. So by us cleaning the plasma in Morgellons, we're able to get all of those things out of the system, and the patient almost immediately feels better. And that's my experience with Morgellons. We clean the house first before we attack the infection. And so that is one of the treatments that I really enjoy doing, because I always see that. And we take out like this much. It's like 3 liters worth of gunk.
Wow.
It's green, dark, and nasty looking. And that goes to the garbage. And it is replaced for proteins, minerals, electrolytes, and amino acids. And it's done simultaneously. So the patient doesn't get disbalanced in their environment. And that's one part of the treatment. The other part is, now when we're ready to kill these infections, we do it systemically, because orally we don't have the right penetration. So we get a central line or a vein, either in the arm or beneath the clavicle, whatever, depending on the patient's vascular axis.
Yeah.
And we infuse a group of antibiotics, antimicrobials, antiparasitics, and silver that we use, that I've been working on and I've been researching for years. I actually graduated with honors because of research that I was doing on nanoparticles of silver with the university. And we're still using that university to provide the silver that we're doing now, but we used that silver for many studies, for HIV, for gastroenteritis, for dengue. We treated 100 patients with dengue.
Wow.
And we reduced the treatment time for half the time. Like, there are so many applications for silver. And so we're now using different concentrations and different sizes of silver to target specific pathogens and specific strains of pathogens.
No kidding.
And so we make that cocktail, we infuse it, and then we heat up a patient with a hyperthermia machine to a moderate fever. And it's not to be confused with a sauna, because a sauna heats a patient from the outside. It doesn't create a fever inside. We need a fever inside, because the fever inside means that the blood flow, instead of flowing like this, it's going to flow like that. And when it's doing that, which is something that we've seen in research, published research showed, I can even share a video with you, you can share with your audience, of a blood vessel looked under the microscope, and before hyperthermia and during hyperthermia, and how all these cells that are usually not moving in the capillaries in the top of the fingers where the circulation is low suddenly start pumping like crazy. As a result, anything that we throw in there at that time will penetrate those tissues. So the silver, the antimicrobials, the antibiotics, antiparasitics, they have a tremendous effect there. And that reaches the patient in more than any other treatment that I've known. And I go everywhere to know about treatments. I go and do research in Germany and in Australia. I go everywhere to know about equipment, machines, upgrades, breakthroughs, and then I incorporate whatever makes sense and whatever actually works. And I put it all under one roof, and then that's why we're able to get the results that we get.
Wow, man, that sounds very technical. Is there anything anybody can do, like at home? Is there a home remedy people could do until they can come see you? Or
Yeah, so I'm going to say there are many things that one can do. I'm not going to mention specific treatments because that would be a certain degree irresponsible for me.
sure,
But feel free to call me. I'm not going to charge you the first consult. You can tell. I can tell you a personalized approach if you can't meet me in person. I
wow,
see people at a distance from everywhere. We get patients from everywhere: Poland, France, Italy, Australia, Canada, the U.S. Obviously, we see patients from Mexico. And the reality is that we have to look into our environment because a lot of the times, as I said, that creates a big problem. The things that we're exposed to, the chemicals, that by itself can make and contribute to the patient's quality of life before even starting treatment. And don't give up because you've seen that it's hard to treat Morgellons. You can get better. You just have to navigate it properly, and we're still understanding it. We don't have like a magic bullet over here,
no,
but every time that we're treating patients, we're getting feedback, and we're every time we're administering things in a slightly more improved manner, and so we're able to give more signs of remission. So we have patients in remission of Morgellons. The majority of patients we treat for Lyme are in remission.
oh,
And
wow.
I'm not saying that this happens to everybody because cases are so different and some of them are so challenging. I see patients sometimes that are quadriplegic,
Mm.
that are, just very challenging. And so those cases, they have a different process and they also get better, but to a different degree. Let's not forget that at the end, some structures may be damaged. And that's not the infection that is causing the symptoms, it's the structure that is damaged.
Oh,
And so we can have patients suffer from neurological issues or mental issues as a result of damage in their brain and their basal ganglia where neurons are. And sometimes those areas that are damaged take a long time to heal.
wow. And so that's one of the reasons for an extended treatment is not just to clear out the infection. The infection can be harbored inside biofilms, and that could take a while to eradicate. There's no way to measure those inside the body, but also the damage that the infection has caused over time.
Yeah, the good news about biofilms is that with hyperthermia and with an antibiotic cocktail, that is actually one of the work that was published by a colleague of ours, Dr. Ying Sang from Johns Hopkins. We're able to eradicate biofilms now. So that's
Wow.
an important part of the process of getting better. If we don't eradicate biofilms, the infection comes back.
Right, right, exactly. The what is the name of that treatment? The where you change out the plasma, where you clean the blood?
Yes, it's plasmapheresis. And there are two methods of doing it: full plasma exchange or filtration. 100% I prefer full plasma exchange for Morgellons.
Okay, okay. Just one more question from the audience. They're wanting to know, are Morgellons fibers at all associated with microplastics?
So that is you know, when I talk about what is Morgellons, I'm going to talk about what my truth is about Morgellons. So we haven't seen microplastics in any of the samples that we've tested. That said, I can't guarantee that it is not linked to it. I can say we haven't seen them in all the studies that we've done. I believe that they're the result of a typical form of production of keratin, that it is mixed with inflammatory cells, and so the presentation will be very typical, and yeah, it's not necessarily from microplastics that we know of.
Yeah, we'll keep an open mind though. The
Oh, yeah.
why do infect? Go ahead. I'm sorry.
No, I just say, yeah, of course, always an open mind
Absolutely.
until someone can prove that they are linked to it. I think we're gonna keep it on the side, and it, I will say, however, patients respond to antimicrobial therapy well, and if it were plastic, I don't know what response would be there that would have that effect with the
Yep.
antibiotic.
Oh, yeah, that does make sense. Um, why do so many infections go undiagnosed for so long? And is there any kind of indicators people can try to keep their eyes open for that would tip them off that something is going on with an infectious process?
Yeah, so if an infection is, if there are signs of infection and your doctor cannot identify the reason, unfortunately, you're going to have to look for a physician that knows what the reason could be, because that's a common situation where the doctors, because we're not taught in the school of these conditions, we're not taught that we need to look for them. And it's just recently that we've seen strives in things improving in the education for doctors. So ordinarily, your doctors will not know, and that's where the controversy starts, and that's where we get the backlash from most of the time. And so I think it's always fair to look in other directions.
And like you said, you offer a free consultation, so we'll put your contact information down there in the description below. Guess we're going to wind it up and finish it out here with the last question, Dr. Morales. And appreciate you making time to be here with us today. What do you like to do in your downtime when you're not being a doctor?
Thank you for that question. So I actually I live in the ocean. I live, in a beach town. Puerto
Oh,
Vallarta is a tourist town where we have fishing, a lot of fishing excursions, and so as a result, almost everybody has a little boat and works around with boats. So I work with boats over the weekend. I have a team who work on the boats during the week, and then I get to join them on the weekends. That's my kind of my stress release valve. And so I fix boats, and from manufacturing small parts for a boat to um, changing their whole appearance to building a complete boat from the ground up. And yeah, it's that, and just having enough time to take my dogs out. I have a Great Dane, a Doberman, a small Greyhound, and a stray mutt. So I
wow.
have time for them at some point too.
That's a lot of animals there.
Yeah, well, I love animals.
That's commendable.
Not all of them, but dogs in particular, I love.
Dogs are definitely personable. Well, Dr. Morales, thank you so much again for making time to be here with us to talk with us about Morgellons and Lyme disease. Where can people go if they want to find your contact information?
Yeah, they can go if they want to talk to us to Lyme Mexico, Lyme Mexico Clinic. I think the website is LymeDiseaseMexico.com and LymeMexico.com. Both will take you there. And we also have very active social media, which I try to update it. I try to update this monthly or weekly sometimes when I can. So you guys can check our Instagram, our Facebook, and our YouTube channels for notifications on videos. I try to record something to just stay updated.
Commendable. All right. Well, I want to thank everybody for tuning in. Thank you, Dr. Morales, and hope everybody give Dr. Morales a call at the office there if you'd like a free consultation. That's commendable that you're offering that to the community, and we'll hope to have you back on the show here soon.
Yeah, thank you, Jeremy. Thank you for your audience as well for listening in, and I hope you guys enjoyed this, and you guys have a great day.
All right, everybody, take care. Okay, Dr. Morales, it's just you and me now.